RadioVal project is an EU-funded project lasting 4 years, focusing on creation of validation framework for medical AI. And in this particular case, we concentrate on validation of radiomic tools used for prediction of response in breast cancer patients, and the predictions are based on pre-treatment magnetic resonance imaging. The major idea was to create something unachievable for humans at that stage. What we wanted to achieve is to find a way to identify patients who will respond to specific treatments, in this case neoadjuvant treatment, and which patients will not respond, leading to personalized care. So far, there were no such tools to tell us, apart from statistics. We only knew that patients with a specific molecular subtype of breast cancer have a chance of response between 20 and, for example, 35%. But it's just a statistic. It doesn't tell me if this particular patient in front of me will respond or will not. Would the response be complete or be partial? As we are closing to the end, we have majority of the tools already developed, such as RadioNac, which is the prediction tool. It will give doctors information on how many patients and which patients should respond to planned treatment. We have a tracing tool that is monitoring the previous one, so it's kind of like a safeguard in the whole environment and the whole workflow. We also developed something which we call AI Passport. It is a very crucial component for long-term monitoring of the tools, and it's very important at the time of sale or acquisition of new AI tools, as it allows new buyers to know what they are buying, how the tool was developed, how it was trained, tested, if it was validated or not. And it contains all this information in easily readable format, and it provides information on how to test the tool after deployment in new place. We also developed something which we call Radio Pack. This is a package of information on how to use the tool, what are radiomics. We explain it on 3 different levels. We provided information for patients, for doctors, and for AI developers. We summarize all the findings and all the knowledge on AI radiomics. We explain what it is, how it works, and we tell how to assess it in the structured frameworks. We can certainly say that the framework is the most important. Over the time, you can see that the tools change, we get new tools, but the framework for testing and validation AI tools in clinical practice will remain and hopefully will last. We created a framework where you can test and validate in structured way. We also provide the guidelines on creation of testing data sets, something that is very important. So far, we were talking mainly about collecting data, sharing data, getting the data to train algorithms. In here, we went another step forward. We thought about which data should not be exposed to AI algorithms for the training and testing, which types of data and how structured, how balanced they should be to omit any biases or to think about those biases. We want to include them in the data that will be used for the validation of AI tools, because we know they don't perform as equally for every single patient in the world. So we need this variety in our final datasets. So that's another achievement of RadioVal project. Those sets of data, but mainly the framework, how to do it, how to validate it, the information that is needed to be collected to formulate the datasets for worldwide validation of medical AI.